us in our country to be celebratory in terms of the progress that we're making. We're not out of the woods just yet, but we have made significant progress. And it's one city in the United States of America that we can focus on being that true example of once being a hot spot, an epic center for COVID-19, with the civic trust that was demonstrated, beating back this virus 3 times, to therefore moving forward vaccination efforts that have literally led in the state of Louisiana and again in the United States of America. This is something that we all should be proud of. And it's those individuals, again, who leaned in to do the right thing, to be vaccinated. So while 15 months ago, again, the city of New Orleans was that hotspot, when the majority of our people in our city had COVID-19, community spread it was, to the point that we could not do contact tracing because it wouldn't help us. But listening to leadership, our people trusted us and again flattened that curve. It mattered. But we're standing here this afternoon, a beautiful day in the city of New Orleans, where the majority of our residents, the majority have taken that shot. The majority have done the right thing to protect themselves and to protect others. And only because of that, we're in a position that we can continue to follow the science, continue to follow the CDC guidelines. And with that, we are ready and we are prepared to remove the mask mandate for individuals who have been vaccinated in our city. This new guidance is a major milestone and a huge victory for modern science and evidence-based medicine. So, we are allowing again mask removal for all those who have received the full COVID-19 vaccine, with a few specific expectations that reflect both federal and state guidelines. What do I mean by that? City government buildings, K-12 schools, healthcare facilities, and on public transportation networks, you will still be required to mask up. These are individuals, again, who can take that mask off outside of these exceptions are those people in our community who are fully vaccinated. We're not out of the woods. The virus is still amongst us. But those individuals who have not been vaccinated are at a greater risk. Now is the time to get vaccinated. There's no excuse in the city of New Orleans as it relates to the accessibility of vaccines. We will continue to do our part, being very intentional, going into communities, meeting our people where they are, giving them the vaccines, having different initiatives and events. Whatever it takes, we are fully committed to, again, meeting our people where they are with the vaccines. But there's no excuse not to have it in our community. The majority of our residents, over 50%, are fully vaccinated. Let me tell you, when you look at the United States of America, the city of New Orleans continues to lead in this regard. And it's something that we should be proud of, and also something I know that I am grateful for, because it reflects the civic trust that has been evident on the ground since we've been going through this pandemic. So with that, again, I cannot stress enough, and you'll be hearing me, I'm getting more aggressive with it. Those who have not been vaccinated need to be vaccinated. I'm no longer even taking appointments or seeing people in my office and giving them time if they haven't been vaccinated. It is a priority. It is something that we must do. I know Dr. Vegno's girls were vaccinated on yesterday. She'll share with that. My daughter has plans to be vaccinated. Her schedule will be on Wednesday coming. We were planning on it today, but we had to switch that up. But she's so excited, and she wants to be that example for her community and for her peers, and I appreciate that. And that's what I'm looking for in every citizen, every resident in the city of New Orleans. And you know what? When I look at, I'm gonna turn it over to Dr. Vegno, but when I look at what's happening in other countries, I'll just pick India, for example, and you have them burning bodies due to COVID-19. It's real. And I know for a fact that if those individuals had access to that vaccine, they would take it. But we're in the United States of America, in the city of New Orleans, when there is no issue as it relates to barriers preventing our people from getting vaccinated. So the message from me loud and clear is to get vaccinated, and even for city employees who are majority vaccinated. They are. But in order to, again, push this even more aggressively, our people can get vaccinated down in the lobby of City Hall, Mondays and Wednesdays from 11 a.m. to 2 p.m. And as you've heard me say even this morning, in preparation for hurricane season, the best step to be prepared is to be vaccinated. And now that city employees all are reserved when we have to respond to an emergency in our city, again, we need our people to be vaccinated. So with that, Dr. Vegno is going to come on up, and then we'll get Q&A. Thank you again, Jamar.
Thank you, Mayor. Thanks, everybody. Sorry, it's a bit windy. To start, I'd like to give an update on our vaccination numbers, and the mayor alluded to these. The numbers yesterday from LDH, I think there were some data issues, so I'm going to give you what we have as of Monday. And as the mayor said, over 40% of all residents, everybody, eligible or not, are fully vaccinated, but over 50% of anyone who is eligible has been fully vaccinated. Over half our people, and over 70% of our seniors, the most vulnerable group, are now protected. These numbers are either at or above national averages. They lead the state of Louisiana, and they are really outstanding compared to other cities like us with large populations and very, very high social vulnerability, very high social needs. So overall, as the mayor said, we have much to be proud of, but these rates are uneven across neighborhoods and groups in our city. At the same time, we've enjoyed over 2 months of low COVID cases, low test positivity, low hospitalizations and deaths, and a rate of transmission below 1, meaning that the virus is not spreading as it has been, again, leading the state and many, many other regions. So because of this progress on both fronts, the outbreak and the vaccine, we feel it is reasonable right now to adopt the CDC guidance for fully vaccinated individuals, namely that they may, if they choose, go without masking and distancing in most aspects of life. And let me just be clear that the CDC defines fully vaccinated as 2 weeks, a full 2 weeks after the last dose of your vaccine series. So if you had Pfizer or Moderna, it's 2 weeks after the second dose. If you have Johnson & Johnson, it's 2 weeks after your only dose. Anything else is not fully vaccinated. If you just got one shot, it's not fully vaccinated. If you're in that intermediate period, you're not fully vaccinated. But this means that if you are still unvaccinated, the burden of risk shifts to you. As fully vaccinated people mingle and go maskless, our current COVID strains and any new variants are unlikely to make them sick. But those strains and variants can still unleash the full effects on you if you are unvaccinated, and you can pass the virus on to other people who are not vaccinated. In addition, I would say we fully support individuals and businesses who choose to continue masking as a safety measure. I'm fully vaccinated, as you all know, But I still plan to wear a mask in large crowds, certain indoor activities with larger groups of people that I don't know what their vaccination status is. That's my choice. We ask that everybody respect others' choices to continue to mask. Many in our community still remain at high risk due to immune compromise or other significant medical conditions, even if they have been vaccinated. So a loved one might be choosing to wear their mask to protect them. If any of our businesses choose to continue a mask mandate for their staff or for their customers, customers are fully expected to comply with this without incident. And any inappropriate or aggressive behavior will not be tolerated and should immediately be reported to law enforcement to address. Keeping yourself, your staff, your family protected is the highest priority for us all. So if you choose to continue wearing a mask while you're vaccinated, we support that. As the mayor said, there are so many options now to get one of the 3 vaccines in your neighborhood with free transportation and with all kinds of fun extras like drinks and burritos and crawfish. And who knew that crawfish was going to be the key? But it certainly was yesterday at our event in the Washington and Broad area. And again, as the mayor said, our adolescents, our children can be protected as well. My kids were among the first to take the shot yesterday because, like the mayor's daughter, they cannot wait to be able to get back to just be a normal kid, which has been denied of them for 15 months. If you need to find a vaccine event near you, go to our fantastic NOLA Ready vaccine calendar online. Just a few examples of what's happening over the weekend. We're going to be outside City Putt, the golf course, the putt course at City Park. Tomorrow, giving out Johnson & Johnson and Pfizer. We're going to be at the lakefront on Sunday, which is a very popular place. You can get Pfizer and a burrito if you're hungry. Again, we'll be at City Hall for employees, but also for the general public. So if you're coming for a service at City Hall and you haven't gotten vaccinated yet, just stop by. We'll have Moderna and J&J. Others will be in Central City, Gentilly, Treme. That's just this weekend. And it goes on and on and on. So as of 6 a.m. tomorrow, we will have revised guidelines to reflect the following. Again, adopting CDC guidance that vaccinated individuals do not have to wear masks or distance during their activities, with a few exceptions that I'll reiterate. We are keeping current gathering sizes and capacity limits for now. And that's because, as we've always done throughout this, we believe that stepwise, progressive, safe reopening will significantly limit the need to snap back drastically if conditions worsen. Many of you have been waiting for me to say these words. Dancing will now be allowed for fully vaccinated people. We are no longer the town from Footloose. The exceptions, as the mayor noted, to removing the mask mandate if you're vaccinated mirror those of the federal government and the state. And again, when you are in any of these places, you will still need to keep your mask on, and that's city government buildings, just like state and federal government buildings, K through 12 schools, healthcare facilities, and then any federal transportation requirements like airplanes, buses, etc. COVID is not over, not by a long shot. We know at least 2 variants of concern are present and circulating here, and we won't really have a handle on how much. The rest of our state lags behind the nation in vaccination and overall continues to see a higher incidence of positive cases than we do in Orleans. And we're not going to be fully protected until all areas and all groups in our community have higher level of vaccinations than we're seeing now. We'd really like to commend those businesses and institutions like Tulane, as you saw yesterday, who are making vaccinations and the health of their community a priority. That is absolutely going to set us up for success as we move forward. As I was looking through our guidelines, I realized that exactly 1 year tomorrow, May 15th, 2020, the city officially came out of our darkest days. We officially came out of the stay-at-home order and our lockdown phase. And as the mayor said, that's when our mask mandate came into being. So it's only fitting, I think, that we take another cautious but hopeful major step into a healthy future on this anniversary. So thank you, guys.
Thank you, Dr. Bagnall. Thank you so much. You know, just looking at you and what we've been able to, what we've been through together, and how far we've come, and it really is, it's a testament to not only leadership, but our ability to build that civic trust where people could trust us and do the right thing. So with that, David.
WDSU and then Fox 8. Is the 1 a.m. Time limit, is that still in force?
That's still, yes, sir. That's still in place, yes.
City workers, is it going to be a requirement for them to get the vaccine?
What, city employees? Right now, it is putting processes in place as it relates to accessibility. And so that's why we have shifted to, in our lobby, having employees who are wanting to be vaccinated get vaccinated. I'll also be stepping up. I'm doing it in stages. And so far, so good, meaning our people are responding to the accessibility as well as the need to be vaccinated in preparation, even for hurricane season, and also with the understanding that we're all reserved. And so with that, we do see people are doing the right thing and getting vaccinated. We really don't have a big problem with it in terms of our employees, but we're not 100%. And my goal is 100%.
Any, with the gathering sizes, any additional info on what it will take to increase gathering sizes when obviously vaccine numbers are...
Sure, we're going to continue. Yes, absolutely. We'll continue to look, at the numbers, of course, signs how well we're doing in our community, that slow and steady, being cautiously, optimistic that we'll see growth with those numbers. But we're wanting to watch. We know that this is a big step that we're taking as well, but we're moving as we always have in line and in step with the CDC guidelines. And so with that still, we want to wait and we want to see. Dr. Vagno, anything to add?
I'll just add that we're taking the same approach we have this whole time. We're continuing to look at the same metrics, and just as we always have, we when we open up, when we relax restrictions, we wait several weeks to see what the effect is going to be on our cases, our positivity rate, our hospitalizations, our deaths, and the rate of transmission. So that's exactly the same. So in a few weeks, we're going to look at those, and if they remain stable, then that would be an opportunity for further opening up.
Fox 8 and then WWL.
Madam Mayor, can you talk about the Saints are predicting in the fall to also fill the Superdome up with fans? Is that an idea you think will be possible come opening?
Well, we hope so. I mean, that's been my conversations and communications with Saints leadership. I believe that we're moving in the right direction. I believe that, the season begins right at September. So we have some time. And so I'm extremely hopeful. And based on the response of the public thus far, again, us leading, not only in this state, but in the country, I believe that we'll be there. But again, if people continue to do the right thing, get vaccinated, this will not be a problem for us as we look forward to football starting in the city of New Orleans and, of course, uplifting our Saints.
Reference of the season opener, and then a few weeks later in October, 2 weeks, the same weeks as Jazz Fest, we got lucky, I guess you could call it, with the schedule, that this off week and an away game. Do you think that will help the city, especially with the EMS worker shortage and just responding to other calls?
So we are, as it relates, Jazz Fest. That is Jazz. Well, I'm thinking about Six Flags. Lord have all of the fest, right? Exactly. So as it relates to Jazz Fest and other events, we're moving through that process right now with multiple departments, but particularly the public safety team that is not just looking and focusing on EMS. Our public safety teams as a whole have just been, they've been leaning in so hard, they really have, and I do not want to stretch them thin, and especially being still in the midst of hurricane season when we're having these events, meaning when they're planned. So I'm going to be taking my recommendations solely from the public safety team as a whole, as it relates to our capacity to man those events successfully. So we're not there yet, but I'm absolutely hopeful.
And have you issued any
No permits have been issued to date. However, we sooner rather than later we're going to get there. But I did not want to do one-offs. I have to look at it as a whole, because when you think about our public safety team and in response to the needs of our community and in the midst of hurricane season, I have to look at things holistically. So with that, I don't, again, want to have a one-off. I want to be able to give great direction on the front end about our capacity to make sure that we provide safety for events. And of course, for those who participate in them.
Yeah, I promise this is it. Back to the mask mandates. This is pretty much an honor system. Those who are not vaccinated, we're just hoping that they will keep wearing their masks, especially when going to places of businesses that require it. Do you think that's possible? Will people follow the honor system?
Well, or they'll get sick. They'll get sick. If they're not protecting themselves, they can get sick. COVID is still amongst us. And the thought it's going away, well, it's a virus. We have to protect ourselves. And so the majority of our residents in our city have protected themselves and therefore are free to go about without wearing a mask. So it's a reward for doing what it takes to protect yourself and others. And so I believe that this will spur other individuals who have yet to be vaccinated to get vaccinated. That's what I believe, and that's what I'm hopeful for.
I know WWL is good. How about WGNO? Any questions? Okay.
All right, thank you all so much.
I think we have the advocate.
That actually answered one of my questions, but has he actually fined anyone for mask violations over the course of the campaign?
Oh, issued a fine?
Yeah.
No, we've never had to issue a fine. Where we have intervened, we've seen compliance. And those were earlier on, like when we first started the mask mandate. But quickly, especially when we had to snap back, people understood that what we were saying was true. And it reflected not only in deaths, but hospitalization, everything that we've been saying. And so my hope is that people will continue to follow the guidelines associated so we do not go back. But any evidence that we're moving in the wrong direction, I think they should be able to trust us as well in knowing that we will put safeguards in place.
And for you personally, were you being literal that no one's allowed to a meeting with you without a vaccine?
Oh, for me, I have given the instruction, absolutely. And I'm so accessible, to people. I don't, and like, you email me and you need something, I have a meeting. No problem. I'm so open. And I will continue to be open, but people need to do the right thing and get vaccinated. So that's my way of saying, hey, I'm accessible, but I need you to be vaccinated.
Can you just remind me of the gathering size limits again?
Oh, Dr. Vec, no, because I don't want to mess
Live and
up.
breathe them. 250 indoors and 500 outdoors.
Can you explain why the 1 a.m. closure is still in place?
Well, I'm keeping the 1 a.m. in place because, one, really trying to, as the city comes back alive, as we have more people visiting our city and activating key areas within our city, French Quarter for one, for example, Bourbon Street and the like. This has been a way that has helped us manage, and we're wanting to ensure that we're able to maintain the capacity levels, providing safe environment. So we're moving through it, and understanding that it's a challenge, as we come back alive, as we get more visitors in our city, but also dealing with some of the constraints that we have along the lines of public safety. So we'll get back to it. So thank you.
We're good? Thank you, Madam Mayor.
All right.
Thank you,
y'all.
Dr. Vecca.
Thank you so much. You want to close us out?
Play us out so far.